Well, we're here with Dr. Kourakin from Millville, and he's a dentist. And the question to you, Dr. Kourakin, is we have talked a little bit before, and so my question is this. People with a migraine, there are not too many people who think that if they have migraine that they should go to a dentist. So what's the deal about it, and tell us about it.
Well, one of the problems, Helman, is the patients, as you said, feel they need to see a doctor. And then the problem lies in the fact that the doctors seldom think that it is a condition that could be addressed by a dentist. They're going to be looking at MRIs and CAT scans and are they eating too much chocolate, their blood pressure, et cetera, et cetera. And quite often the referral may be to a neurologist or a pain management specialist if a neurologist and the physician doesn't get anywhere. So they simply sedate these people. They put them on pain medications there, and they tell them, here, take this antidepressant drug, take this pain pill, and don't bother me, unfortunately, or bother me only if you need more prescriptions.
Basically, the idea about a migrant, from what I see from many countries, my family still lives in Austria, and the idea from doctors all over the world seems to be this: look, you have migraine, and more or less the only way we can fix it is by sedating you. We can't really fix it. We just can make it comfortable for you, give you medicine to do it. But that's not your take. That's not the take of actually a bunch of dentists out there.
Correct, Helmut. For instance, I'll give you one case point, an example. I had a patient who came in who had been treated by so many different practitioners, medical practitioners, and he finally heard about, for instance, Botox injections. He was referred to me by his dentist just because he had a conversation about his migraines. He traveled an hour to get to our office. We examined him, we assessed the condition, and sure enough, we realized that for him, Botox would work. We gave him 2 injections here, 3 injections here on both sides of the head, and he came back 2 weeks later, and he had a 75% reduction in the migraine headaches in that 2-week period of time. We further evaluated him and realized that if we just went further up, to inject 2 other sites on both sides there, we were able to actually eliminate 95% of his migraine headaches there. The gentleman just can't say enough to us there.
Unbelievable.
The evaluation is kind of time consuming. And there are about 34 different sites, 34 different muscle injection sites that you can look at that need to be either diagnosed for or eliminated from an injection site. And then, of course, there's the treatment modality of an appliance that needs to work with the potentially Botox injections or muscle relaxers, not antidepressants, not pain pills, just one muscle relaxer taken before bed at night, and that's it. So you're not sedated. You can go about functioning throughout your day. And a combination of working with my team of physical therapists, where we can use different infrared treatments and a low range of laser to also be able to get the muscles to relax. And it's amazing. The results sometimes can be seen almost instantly.
Wow. So let me ask you, okay? So you mentioned here, it looks to me, you mentioned here 3 different basic ways on how to fix a migraine without, of course, the traditional way of all kinds of medicines and stuff. So one is Botox. Another one is maybe some appliances in the mouth, like a mouth guard kind of things, which is, and the other one would be some laser therapy, which somehow again relaxes the muscles. Because it looks to me like what you're saying here is that the migraine really comes from the misaligned mouth somehow, be it for chewing, be it this, be whatever it may be, and then all those muscles are connected all the way up to the brain, and they pull in the wrong area, and you simply get a major migraine. I have heard that the joint where where our mouths are flapping, that is one of the most complicated, or the most complicated joint in the body. Is that true?
Yeah, that is very, very true. And surgeries of TMJ are extremely complex and generally have only very, very limited success. And anymore, just about anything is going to be done for the patient before they'll consider a TMJ surgery. But Helmut, you said the head, but these are pains that will actually radiate down to your clavicle, all the way down to the shoulders there. There's an area here called the sternocleidoid triangle. So these are the muscles of the neck, the back of the neck, down to your clitoid or your scalp, the top of your shoulders there, and the back of the neck, all those occipital muscles there. These are the areas that we're looking at, not just from the head up.
So
many patients.
So what you're saying is, so okay, first of all, a migraine, and thanks God, the only time I have a headache is if I'm dehydrated or eat really bad food and I have to throw it up then shortly before I get some headaches. But rather than that, I don't know what it means. So it's not only the headache, bad enough, but then there's the shoulder. And for instance, I do sometimes, I know how bad that is if you drive and you cannot you turn because it's hurting. You probably can't sleep so well if it's hurting. So all that could be connected to the mouth, basically fixed by then to the jaw and fixed by you. So back to this kind of three things. First of all, was I right with that? There's the Botox, there's the appliance, there's the muscle relaxer. We are done via laser or something. And do they, if it is only those three, fine, and otherwise give me the other one. And do they all three need to be done, or it depends on the case? Sometimes one or the other may be enough, or sometimes a combination of them might be needed.
A full diagnosis will let us know whether or not it is just a simple treatment with one appliance, one treatment modality, or combination. Quite often, I like to at least employ two of the modalities. For instance, physical therapy, I think, should be incorporated in just about every treatment, because one thing, let's take advantage of your insurance, your medical insurance there. Most medical insurance will cover it. There is never a better way to prevent a problem than to be preventive in nature there. So if we can give you some exercises that you can do for the muscles there, if we can do something that can be done simply with heat or with cold massage therapy there, let's be as conservative as we can. Let's teach you how to take care of yourself so that maybe you won't need any other treatments in the future there. So I like to always couple physical therapy with whatever dental treatment I'm going to employ.
So that would really actually, based on my analysis here, or my explanation, that would be the fourth one, the physical therapy. Yes. I kind of left that out, and that should always be there. Now, Dr. Kourakin, what makes you being able to diagnose this and find the wear so much better than somebody else? What are you using there? How do you go about this?
Well, the one thing which is so simple is simply a extraoral, in other words, examination of the muscles of the head and neck. And for the life of me, I don't understand why a lot of doctors don't do that, to try to find trigger points, to try to find areas there, of the head and neck, number one. Number two, we can actually do an analysis of the forces of the bite. And if in doing the analysis of the bite forces, we see that the bite forces are within normal range, then the migraine may not be of dental origin at all. Maybe it is a chocolate allergy, or maybe it is related to some sort of cervical injury that you had in an accident, or blood pressure, or whatever there. So we need to do the screening to make sure that it is indeed of dental origin.
Right. So what you're saying here is this. First of all, a person starts having migraine and stuff, and especially if he realizes, which most people should, but maybe don't do, that all kinds of drugs, we were not born with a drug deficiency in the, just not about it, that maybe something mechanical in the head can go on, and a dentist can do it. So go to a dentist and figure it out, whether you have been already at a bunch of doctors and you came to a dead end, or whether you're at the beginning of having this headache type of stuff. Go to a dentist. He will basically, and of course it probably has to be a dentist who is trained in that. Maybe not every dentist is trained in that either.
That is correct, because this is an area that is very sophisticated. The diagnostics have to be quite in line with the medical community and what's occurring with the diagnosis with the physicians there. So if a dentist is really a cosmetic dentist or only a drill and fill kind of a guy, he's not the one you want to see. You really need to find someone who's going to be able to handle the different treatment modalities, as we said, the Botox, the appliances there, working with the physical therapist, maybe in-house or out-of-house there, and drug therapy in terms of muscle relaxers.
So synergy is the key here, I guess. Like with almost everything in life, very rarely one thing fixes everything. It's always like a combination of things working together in synergy to make it good or bad, whatever the direction might be. So wonderful. Well, thank you very much, Dr. Kourakin. It's very enlightening, and it's amazing how the mouth, the teeth, how a dentist, how many things he fixes. Number one, he makes us good looking by having a bright smile, $1 million smile. He fixes headaches, migraines, as you just said, shoulder pain, with gum disease, any kinds of disease, because the immune system goes so low, will be avoided, even stillborn babies. It's unbelievable how many things, a dentist actually takes care of. We don't think about it.
No, and Helmut, what's really sad that we're seeing right now, especially in our geographic areas, how poorly socioeconomically we are performing. The economics of South Jersey, are in a poor financial pocket. And people are really stressing over this, and the stress levels there are definitely contributing to, these issues of clenching the teeth, grinding the teeth. Bosses are on people's cases there. People are expected to perform more. They're expected to deliver more. A lot of tension, a lot of pressure is put out there on individuals there. And I have people coming in here. It seems like once a week I'll get somebody who comes in here just is ready to explode. And unfortunately, the side effect of that is a lot of the tension in the head and the neck area there. Right. Grinding of the teeth, the destruction of the mouth, and it's a vicious cycle.
A very vicious cycle. I mean, it's a snowballing effect. It's a twinning spiral like there's no belief. Because now he gets a headache, and I can't assume how a person with a constant migraine, even if it's just once every few days, can work well or can have a good family life, because you're at home. You get frustrated if the kids or the spouse kind of want something from you and you have a migraine or at work. How can you come up with good solutions and ideas for your work and work competently if you have migraines and clenching and have other stresses? Well, Dr. Kourakin, all the best with that, and let's hope that lots of people see this video and basically take advantage of it, because help is there. It can be done. Thank you very much.
Thank you, Mr.